All right, good morning and welcome to this breakout session. Feel free to turn on your camera if you'd like, but please stay on mute until the question and answer session. My name is Kim Slawson and I am the Advanced Practice Provider Team Lead for the Survivorship Clinical Services. I've been a nurse practitioner since 2014 and have been with Duke since July 2017. Survivorship is something that I'm very passionate about, and I'm thrilled to work with one of the world's foremost experts on survivorship, Dr. Kevin Effinger. My coworker, another nurse practitioner, would love to have been here today, but she's on maternity leave. So let's get started. Can you guys see my screen? Okay, all right. We're going to talk about the 5 W's of survivorship: who, what, when, where, and why. So what do all of these famous people have in common? They've all been diagnosed with cancer and all are survivors. The National Cancer Institute states an individual is considered a survivor from the time of diagnosis through the balance of his or her life. I wholeheartedly believe this is true, and everyone diagnosed with cancer has my utmost support and respect. They and their families are the true warriors. But even while this is true, we need to narrow down the focus to exactly who we can offer our services to. Let's talk numbers. In 2016, there were over 15 million cancer survivors in the US and more than 32 million worldwide. It is estimated that with improved treatment and early detection, the number of cancer survivors will increase to 20 million in the US by 2026. That's just 6 short years from now. Most are over 10 years out from diagnosis and over 65 years of age. And far more survivors live with prostate, breast, and colorectal cancers. So let's narrow it down a little bit more. Just the cancer survivors at Duke. Looking at just an 18-month period for these 4 cancer populations, you can see that there are over 11,000 unique patients seen during that time who are less than 5 years from their cancer diagnosis. However, there are over 7,000 patients who are between 5 years and 20 years from diagnosis. Duke does a tremendous job treating their patients, and we are honored to be able to see this unique patient population. So who's eligible for these services? If a person can relate to any of these questions, then survivorship care is right for them. They've completed their cancer treatment years ago. That's fantastic. Now what? Does the primary care provider know their long-term effects of their cancer treatment? Their oncologist can only see them once a year, but who manages their other health needs? Or they've neglected their other health concerns due to their cancer treatment. What should they do? And especially this year, has your yearly appointment with your oncologist been canceled to COVID-19? We like to think of survivorship as a bridge. We are a team of physicians and nurse practitioners who work as a lifeline between the oncology and primary care teams to create the best plan for a person's overall health. We are currently seeing patients in the cancer center, so we can bring in a member of the oncology team if there is a concern or new problem. We also work with their primary care provider, or otherwise known as their PCP, to ensure that all aspects of their health are being addressed. Let's talk about the clinical team. We are fortunate to have Dr. Kevin Effinger as our physician lead. He sees patients on Wednesday morning in the cancer center. We also have Dr. John Ragsdale, who sees patients on Tuesday morning. They are both excellent physicians and truly in their field. Both Brandy Vile and I are family nurse practitioners with extensive oncology backgrounds who both started with survivorship in January of this year. We are truly excited to become part of this program. The physician clinics tend to focus more on cancers in which patients have received higher doses of radiation and or chemotherapy and are at higher risk for recurrence. These include all patients that underwent bone marrow transplant and all childhood cancer survivors. They're at risk for more toxicities from their cancer treatment and are more than likely to have even more long-term effects. The Advanced Practice Provider, or APP clinics, are now open to breast cancer patients who are about 5 years from diagnosis, prostate cancer patients who are about 2 years from diagnosis, and patients living with chronic lymphocytic leukemia. You may be wondering why we are seeing these patients who are living with chronic lymphocytic leukemia, which is otherwise known as CLL. These patients often go years after their diagnosis before starting treatment and are often stable for many years while on treatment. During this time, they often put off going to see their PCP and only will come see their oncologist. But if their other health conditions are neglected, for example, if their blood pressure is not well controlled, they can't stay on treatment. So we are trying to work with the oncologist and PCP to help them be as healthy as possible for as long as possible. We also hope to open soon to the lung and gynecology cancer survivors. As you can see, the primary care provider manages the patient's health needs until the patient is diagnosed with cancer. Then they spend the next 2 to 5 years dealing with cancer treatments as other health conditions often take a back seat. At the end of that time, they have beaten their cancer, but their overall health has worsened. So how do we get referrals? We have spent the last few months building an electronic referral in our computerized charting system known as EPIC, so providers will soon be able to refer patients through an order in the system. Until that goes live, hopefully next week, we also have been receiving referrals through emails or phone calls from the providers. We are also seeing patients who are new to the area and need to establish care. Also, word of mouth is a great way that we get patients to Duke. Dr. Effinger receives many referrals throughout the country from patients who will travel specifically to see him. We are also hoping that the APP clinics will benefit from word of mouth. We offer flexible appointment options. We offer telephone and video visits if the person does not feel comfortable coming into the cancer center during this pandemic. We also see patients in person at the cancer center on Duke's main campus. We have plans to expand into other areas of Durham and Wake County in the future. So let's talk about the visit. As I spoke about before, we base the time of transition on communication with the disease team. For example, breast cancer patients about 5 years from diagnosis and not on active chemotherapy. They can still be on their endocrine therapy and we can help order and manage that. Prostate cancer patients are about 2 years from diagnosis and not on active chemotherapy. So once they transition to us, these are the focuses of our visit. We monitor for recurrence of their primary cancer or any secondary cancers. We can evaluate their medical and psychosocial late effects. We educate them about their survivorship issues and the availability of community resources. We spend a lot of time with health promotion counseling. And then after that, we provide clear communication with their primary care provider. There are many late and long-term effects of cancer treatment. Late effects show up many years after treatment. These include heart and lung issues from certain chemotherapies and radiation, for example. Heart issues can develop even 20 years after certain chemotherapies. Late effects include infertility and secondary cancers as well. In contrast, long-term effects usually start during treatment and may persist throughout the person's life. These include neuropathy, which is tingling of the fingers and or toes, fatigue, hemobrain, anxiety, or depression. As we are the providers in the middle of the bridge from earlier, a huge part of our time is spent coordinating care. We know that the PCPs are the experts in managing their high blood pressure and diabetes, where they should get their health promotion and maintenance, and where to go if they get sick. We educate the patients about this so they don't return to the cancer center or urgent care if they get sick. We try to steer them to their PCP and promote that communication. We are so blessed to have a huge number of resources at Duke. Beyond the oncology team, there are so many services that patients can access, even if they're not on active treatment. Many patients don't know that they are still eligible, so we can make that referral and get them the help that they desperately need. And this is a care pathway that we developed specifically for the breast survivorship group, but this can be modified for any disease group moving forward. We see the patient, either virtually or in person. We complete a thorough history and physical. We assess their late and long-term effects, monitor for other health conditions or mental health issues. We can order routine labs or imaging, such as bone density scans, mammograms, etc. If the person remains stable, we encourage them to see their PCP, and then we send the PCP a letter of our findings and recommendations. We usually see them yearly and repeat the process. If at any point their status changes and there are any red flags, we refer them back to oncology as soon as possible. I actually had this happen a couple of weeks ago on a Friday. A delightful lady had a lump discovered on her routine mammogram. She came over to see me and then was biopsied later that same day. It turned out to be a recurrent breast cancer, and she was referred back to her oncology team and saw them early the next week. Many survivors have a primary care provider that they like, and we communicate with them. But if they don't have a primary care provider or want a new one, we can help them find one. Duke is a huge network, and we have over 40 primary care sites throughout many counties in North Carolina to choose from. We try to find a Duke PCP so that all records can be accessed for continuity of care. However, if they live outside the area, we still try to find them a good PCP and communicate via phone or fax. We're also identifying champions of post-oncology care that understand patients' post-treatment needs and work with us to provide a plan of care for their patients' best overall health. This is the number of Dr. Effenger's wonderful staff specialist, Yolanda. She speaks with the patient and helps them schedule their appointment with our providers. Every patient that speaks with Yolanda knows that she loves her job and is committed to the quality care. There's our website, my resources, my references. Does anybody have any questions? Feel free to turn on your microphone. Silence. No questions?
I'll start a question.
Okay.
Jean, I see you on there, and I saw Kelly was on there, and Pam. This is exciting, what Kim is doing. This has been a long time coming and really establishing it. And it'd be great just to hear some feedback of what your all's thoughts are of what the program she's put together.
I have a question.
Sure.
So do you flag charts to do callbacks on patients who are not active in the primary onco clinic? Like somebody who's 4 years out, you know, would you in the following year call them and get them involved in the clinic?
We are trying to find a way to do that in Epic, trying to run reports so that we can identify more patients that would be eligible for our program.
Thank you.
It's been challenging. We've been looking at all of the oncologist schedules to see if there's anybody that we could talk to about transitioning to us. Hopefully the referral in Epic will make a huge breakthrough in getting more patients to see us.
Thank you.
Janet, that was a great question. And while Kim was talking, I was thinking, this is actually a perfect recording to send out through my chart to a lot of our prospective patients who we're working with the breast group. I mean, Kim, that was a spectacular presentation of what's going on.
Right, I'm excited. It's everybody that has came through our program has been pleased because we're able to spend more time with them than the oncologist does. And we talk about everything, and so many things come out in our visits. It's really, you know, like, oh, I've never had this much time to talk, and they feel really good about it.
Mm-hmm. Great.
Can you hear me, Kim?
Yes, sure.
Oh, thank you so much. Yeah, that was so well done, and I really appreciate it. And I'm just a little overwhelmed by everything that you guys are doing. I think it's really fantastic. Being a long-term breast cancer survivor, I've actually sort of stopped taking care of anything concerning oncology. I actually fired my oncologist a couple of years ago. It just wasn't going too well. So I walk around with my fingers crossed and my head in the clouds most of the time. So, but I just think it's wonderful that you're providing these services. And I know even the very first time I heard Dr. Effenger speak about long-term effects, and I was like, oh my gosh, no one ever has discussed that with me. So it was so helpful then. I'm sure it's even more helpful now. And I know Cheyenne mentioned earlier that this is just such a stressful time. And I have discovered that for many reasons. And so, you know, I think providing these services and helping people the way that you guys are is just a marvelous thing. So thank you.
Well, thank you for saying that. I don't think a lot of patients realize that a cancer diagnosis speeds up the aging process. So, you know, things are going to start happening sooner, and
Oh, wait a minute. Wait a minute now, Kim. Is that, don't put that on the website.
No.
Don't let anybody know that. Don't send that energy out there either. I don't know if a cancer diagnosis actually speeds up the aging process. It might make us a little wiser.
True. Most
And we
definitely.
might actually take better care of ourselves.
I think so. I truly think so. Yes.
Mhm.
Yes.
So I would erase that statement.
Don't, it's erased.
Don't use that anymore.
Crystal? Yeah. But I just do definitely think, you know, the health promotion and, you know, maintenance is huge. And we spend a lot of time on that just because they don't think about some of these things, like their vitamin D or, you know, their pre-diabetes, things that can, you know, really affect their health.
Kim, I just want to echo what everybody else has said. This is such an awesome program, and you did a great job presenting it. And I don't remember if you remember, we met briefly in March, I think, right before all this happened. And I was so excited to hear that you were starting this program. It's something during my career as a nurse practitioner, I really wanted to be able to focus more on with my patients, but you just can't when you're doing the other aspect. And so it's awesome that this is available for people now.
Yes, I do remember meeting you. Yes.
Yeah.
Yeah. Before the, you know, the world went crazy.
Exactly.
Definitely.
This is Josephine, and you put together a wonderful program because people are not out there dangling. Who do I see? Who's going to understand me? Who's going to listen? What do I do? Am I seeing the right physician or not? So thank you for putting this together.
Oh, my pleasure. My pleasure. I'm so happy to, I mean, everybody I have met as a survivor is absolutely wonderful. I mean, it's been a great program. And I appreciate Dr. Effinger giving me the chance to work with something I'm very passionate about.
Yeah, because I've met several cancer patients that have said, what do I do now? I don't know where to go. I need help. I have all these problems.
I'll send them my way, definitely. Have them reach out to Yolanda or, you know, be happy to see them. Steer them in the right way.